All right, YouTube, check it out. This is the one video you need to watch if you're a bodybuilder using performance-enhancing drugs. If you're new here, my name is Coach Kolton. I help people build physiques of a lifetime with easy and simple tools. If you're a bodybuilder using performance-enhancing drugs, there are a lot of ancillary medications that you can use to inhibit yourself from falling over and having a heart attack, like 99% of the old motherfuckers in this sport. One of those ancillary medications that I recommend to almost every one of my clients, it very much so depends on their situation, their resistance to potassium, overconsumption, and a lot of different variables, is an angiotensin receptor blockade. Now, the ARBs are a class of medication that do a very powerful thing in the body, but most of its outcome is going to relate to lowering blood pressure. But one fact that not a lot of people consider when it comes to left ventricular hypertrophy or the growing of one's heart, another massive problem within the bodybuilding community, is that ARBs actually inhibit the growth molecule that's stimulating left ventricular hypertrophy. So not only are you going to lower your blood pressure by taking something like a telmisartan for 40 milligrams a day, which I take at night, by the way, you're also going to inhibit the growth of that left ventricular, which is going to keep you alive for longer. One of the biggest problems, again, that bodybuilders are facing is the growth of their heart, and we need to attenuate this. And one tool that is an amazing tool on many levels, both for blood pressure control, sympathetic innervation, meaning that you're not always in an intense hypervigilant state where your heart rate is maxed out and your blood pressure is maxed out, but also it is going to attenuate the growth of your heart from using androgens and things like growth hormone. Left ventricular hypertrophy, just in and of itself, without any of the other downstream effects of it, can cause life-threatening events and aortic dissension. Transforming growth factor beta is what causes the heart to grow most of the time. It's one of the main inputs. So if we can insert 40 milligrams of telmisartan a day, which is a very innocuous dose, and most people won't even realize or have any side effects from taking a dose like that, talk to your doctor, of course, if you're watching this and you're a bodybuilder using performance-enhancing drugs, or you just have high blood pressure. But 40 milligrams a day can literally save your life. And it's something that I need people to understand, because we too often see people leaving this sport early because they're accumulating these detrimental effects to their health, and it is very, very unfortunate. So one tool to apply right now to your bodybuilding career: go to an online supplier, find yourself some telmisartan, go to your doctor, talk to them about having a history of high blood pressure, and get on some form of an ARB, an angiotensin receptor blockade. If you can do that, you will lengthen your career. You will save your life in the late stages, 50, 60, 70 years old. And again, it's going to disenable you from having some of the acute short-term side effects, such as a higher resting heart rates and a higher blood pressure, which is massively important for other organ systems such as your kidneys, pancreas, and brain. So get yourself some ARBs, get on them, shut the hell up, take it like it's a multivitamin. That's my advice. But one caveat here, and I was just about to end the video, but I got a caveat. Don't eat too much potassium. These drugs are very potassium sparing. You can find that a small amount of potassium will actually increase serum potassium levels quite strongly. I personally don't know the correlation there. I'm not versed enough in this pharmacology to understand why ARBs increase potassium in serum, but they do. And when I'm saying serum, I mean blood serum. So be careful with your potassium intake. Check your blood regularly, as you should be doing every 12 to 18 weeks as a bodybuilder, and you should be good. Okay, deuces.